I'm a general practitioner and I'm working at the Bendigo District Aboriginal Co-operative in Bendigo in regional Victoria. And I've been here for nearly 4.5 years. I've really enjoyed my time working at the ACO, and it's one of the most rewarding jobs that I've ever had. So I've been a GP, a fellow since 2014, and I worked in suburban Melbourne for a couple of years, locumed for a year, and then did a locum in Cherbourg in southeast Queensland, which was my first exposure to Aboriginal health. And I found it really interesting and really rewarding. And then this job in Bendigo came up, so I moved my life up from Melbourne to Bendigo, and it's one of the best decisions I've ever made. The work is really interesting, and it's probably the most meaningful work I've ever done in my life. I'm a big believer in practicing medicine where it's most needed, and I think you find few areas harder pressed in the medical system or in health in Australia that need good quality primary care than Aboriginal health. We've got a really good team here at BDAC. I'm surrounded by excellent colleagues, nurses, Aboriginal health practitioners and support staff who really make you feel welcome. And if you don't know the answer to something or you're a bit unsure about how to approach a problem, you've got a lot of people around you who you can talk to and who are happy to assist you. Our patients are amazing, really beautiful, lovely people, resilient. And very different to, I think, the stereotype that a lot of us in healthcare and maybe broader community think about Aboriginal health and Aboriginal people. I found all of my patients are very receptive to getting health advice, value my opinion, follow my health instructions, and in fact, so value my opinion that even if a specialist tells them about a new medication to take or a different pathway to take, will come and double check with me that it's okay before starting it. I think that's one of the most rewarding things about general practice, but Aboriginal health in particular is spending time in an ACO. You really reap the benefits of that ongoing continuity of care, having a really positive impact on someone's health and their trajectory through the healthcare system. And also there's scope, I think, for advocacy as well, because a lot of our patients need someone to help advocate for them or prosecute their case sometimes, because I found a lot of my patients have been poorly treated by the healthcare system and have been the victims of racism in particular. And it's quite shocking in this day and age to see it. Advocating for your patient, trying to ensure that your patient gets the best outcome possible. It's not only the right thing to do as doctors, but it also helps build that relationship and helps build that trust, which is, I find, really paramount in Aboriginal health and Aboriginal healthcare, but you could argue for healthcare in general. I've learned medical skills that I didn't have when I started here, and I'm much more aware of the social determinants of health than I was before I started. Usually I was quite medically orientated. I'd just ask about past history, what medications are you taking? Now I ask things about housing, finances, can you afford the medication that I'm giving? How many people are in the house? Mental health and the impact of mental health with medication compliance and trauma, historical trauma, all things I'd never even thought about asking or considering are now kind of routine in my healthcare approach to patients. And I think I've become a lot more whole person focused than when I started at BDAC. We were the 2019 RACGP Victorian Practice of the Year. And I think we won it mainly because of our multiple services. So a standard medical clinic is doctors, nurses, reception staff, of which we have plenty. But we've also got Aboriginal health practitioners who act as kind of our conduits into community, help patients get to clinic, explain medical conditions to patients, aid with compliance of treatments and medications. We've got our own drug and alcohol service here as well. So we have male and female AOD workers. We also have a dual diagnosis clinician who manages our patients with significant mental health and substance use disorder issues. We've got an aged care service, so a hack service, which helps some of our patients get home care packages to keep people in community longer, so people can stay at home in good health with community, which we know is what most of our patients want. We've got ITC, an integrated team care program, which is about helping fund patients to access specialist care that's not available here in Bendigo, whether that be public or private, transporting patients to and from specialist or allied health appointments, and also helping advocate for patients in their care, and also case manage patients as well, so that we're on top of patients, or some patients who've got multiple medical conditions going simultaneously. It's very much a wraparound service, and even in the clinic, we do a lot of medicine, I guess, that might not be in most clinics, just because a lot of our patients feel quite happy and safe coming to the clinic. So we try and provide as many services as we can within the clinic, so we don't have to refer out if humanly possible. It's important to separate work from recreational time as well. Otherwise, the risk of burnout. So it is really important to set those times apart and delineate between both of them. But I found anyway, when I first came to Bendigo, people were quite willing to assist with the move and give advice as to where a good location to rent your house would be, and the other services and what Bendigo could offer. There's good restaurants and there's quite a few good pubs around as well. So I like a good meal. So there's quite a bit to do there. There's quite a few running tracks around as well. So I like to run also. So there's that. And I do a bit of yoga and meditation, and there's a good yoga studio that I go to, and meditation. I do that at home anyway. Bendigo has a lot to offer. It's quite a large town. It is like living in suburban Melbourne in many respects. It's not like the CBD, but it is really like maybe one of the outer suburbs per se. There's a lot of people around as well, like a surprisingly large amount of people, more than I thought. And people are very friendly and happy to have a chat. And there are a lot of people who've come from Melbourne for work or whatever. So there's a lot of people who are in the similar boat to me as well. So it's been fun. I would say definitely consider it. For me personally, the work I've done here at BDAC has been the most meaningful and impactful work that I've done in my career thus far. I've really got a lot out of the work that I've done, if nothing else. Hopefully, like I mentioned earlier, hopefully my patients have also benefited as well. Working in Aboriginal health, it can be stressful. There can be a lot of pressure, and you can be dealing with some quite complicated situations. A lot of the time, you're not by yourself, and there's always people to bounce ideas off and talk to. And the people I usually talk to are the people who are around me, whether that be nurses, Aboriginal health practitioners, and usually a problem shared is a problem solved in many respects. So trying to share some problems and trying to get other people's inputs is quite important. I'd strongly encourage anyone who's interested in working in Aboriginal health to do so. It's a really rewarding field of medicine, and it's really rewarding work, and something that does change you, and it does shape your view and your thoughts about healthcare, social justice, equity, social determinants of health, things that I've never really thought about before or just given token notice to.